Okay, everybody, we're very excited here at AMP Sportsman and Recovery to have the Viper 2.0. It's the most innovative foam roller out there to get deep down through all layers of tissue and increase that circulation of those locked up tissues. Now, we're gonna go over a proper way to foam roll with the Viper for common low back pain. Okay, so there is a wrong way to foam roll, believe it or not. You can either activate or inhibit muscle tissue because of the amount of time that you spend rolling on a structure. There's the Pacinium mechanoreceptors and there's the Ruffini mechanoreceptors. One activates, one inhibits. So we are gonna go over an effective way to help get rid of low back pain with the Viper 2.0 by either activating or inhibiting structures. That being said, there's also an order that you wanna follow, okay? It's like when I go get some steak, and they follow the recipe, it's gonna taste miraculous. But if I don't, they're still gonna finish the steak, but I'm gonna get some bland steak with no flavor and no taste at all. So if we follow a specific order on how to foam roll, you're gonna unlock some back pain versus just rolling out mindlessly. It's gonna feel good, don't get me wrong, you're gonna increase circulation, but you're not gonna be able to address the problem. Now, is foam rolling the solve-all for every one of our problems? Absolutely not. But it is a start to help unlock some of that locked up tissue that becomes stagnant and becomes chronically tight or adhesive, okay? We're all made up of extracellular matrix, which is a ton of tissue that comes together. When that tissue becomes stuck and lacks movement and circulation, it leads to decreased range of motion, which will then inhibit movement, which will then lead to pain factors. Okay, so here, using our Viper 2.0, and here we got our Viper 1.0s as well, we're gonna turn this on. This is an awesome piece of equipment because it has 3 speeds and it's gonna vibrate. On top of that, it's not gonna hurt. Whenever I roll out, it hurts in certain areas. This is not gonna hurt because we're increasing circulation, increasing blood flow, thus getting those pain fibers to shut down and inhibit. Okay, so first thing we're gonna do is we're gonna go over that glute muscle, okay? All the muscles that come back here and make up our SI joint, when we're sitting down, we're compress. This part gets locked up. That's what we're gonna focus on opening up. Okay, so proper way, I'm gonna show you the back side first, is I wanna find that SI joint here, and I want to go right inferior to it, okay? I get my Viper on. I like to go on level 3. So when I roll back, I'm gonna use my opposite arm as I'm balancing on one side, and I'm gonna twist it over, rolling onto that sacrum, and then I'm gonna open this part up, opening up all those external rotations, and then twist back, opening my body, treating that glute muscle like a fan, bringing it back over. Nice and slow. What does this look like? It looks like I'm trying to stretch my internal rotators and my external rotators. Opening up those hip structures. Okay. This is how fast that Viper moves, keeps dancing on us here, right? Next thing we're gonna do is we're gonna continue to focus on that posterior chain. We're gonna now move on to the hamstring. Come just inferior to the hamstring, right at the ischial tuberosity, okay? Now, what I wanna do is I wanna roll the tissue down because my hamstring becomes adaptively shortened here because I'm sitting all day like this. I wanna be able to elongate it down. Find my structure. I'm gonna put my left leg on top of my right to add more weight to it. I'm gonna come back, roll that tissue down inferiorly, keep the machine on, roll back up so I don't have as much pressure. Now, roll it down inferiorly. That way, we're taking the pressure off of that hamstring, but I would think of the muscles like strings. I want to pull down to open up the structure of my SI joint. I'm not going to roll as hard on my way up as I roll on my way down. Okay. I don't want to dance you so much that time. Now we're going to roll onto our hip flexor, okay? in through here, we want to be able to open up this whole area. So when I focus on this foam roll, I always go on the way we typically stretch it out. Tuck your pelvis and reach up and over. Now, remember that movement as you get the Viper onto that hip flexor, okay? I also want you to remember internal, external rotation. Our tendons here at the insertion point, at the origin point, they connect here. If I'm able to open it up and get that rotation, get some pelvis rotation, what are we gonna be able to address? Many of our patients that come in, many of your clients that come in, all have something wrong with pelvic rotation. We're gonna be able to address that here and now. Okay? So I jump on it, then I'll turn it on. Here we go. I'm reaching up, and look what I'm doing. Bending down, creating pelvic tilt, and I'm using my opposite leg to tuck it in. So now I'm gonna create motion. I'm gonna use my arm. I'm gonna come out, roll down from inferior to superior on that psoas, and then come back up, rolling down to that quad and rectus femoris. Creating movement, hip flexion, circulation, decreasing the amount of pain. Then my next movement, again, I'm reaching up, going from external to internal rotation, unlocking that deep hip flexor and that hip joint, and increasing pelvic rotation, especially when it's lacking. Okay. Lastly, for low back pain. Yes, we can move them to the quads. Yes, we can focus on that patella. Yes, we can go to the calves. Yes, we can roll out the bottom of the foot. We can do all that, but for sakes of this part of the video, for unlocking low back pain, here, we sit all day, or we stand all day. Our thoracic spine lacks mobility. The lack of mobility in our thoracic spine leads to chronic low back stiffness. So for all you guys that sit down on a desk all day, on your iPad, or standing all day, this is perfect. So here, I go and get into that mid back. Typically a lot of us are doing this, we're doing this. We're trying to get that to open up. Here, get our Viper on. Oh, feels nice. Getting that circulation. Getting my pelvis nice and even. Arms up. Increase that range of motion. And bring it back forward. Opening up that thoracic spine, reaching up. Every time I come through, elongating that tissue. Here, I even like to get different variants. I come here, in between my scapulas, get some shoulder external rotation, roll over, get some internal. Even like to create a wall angel, because some of us can't do this in restriction in our scapulothoracic joint. So here we're increasing mobilization. You can even bring it all the way across, open up that structure as you come across. Different variants to mobilize your thoracic spine and help get rid of that back pain. Lastly, a lot of us, we want to unlock our mid back or create a manipulation in our SI joints. Perfect way to do this is you're gonna activate your adductors. I like to put on level 1, and I just sit here, activating my adductors, opening up my SI joint, as I try to slowly increase that mobilization in that SI joint. Then I try to do some little yoga twist here, nothing too aggressive. Constantly contracting those adductors, not dropping that foam roller. Lastly, try to create some bridging, activating the glutes, opening up those paraspinals as I contract the adductors. taking simple movements, simple things, but making it specific for you. At AMP, we use a lot of our high-priced equipment. We use the Raptor, moving at over 3,000 percussions a minute to manipulate soft tissue. It is our job, it is our duty to also help educate you at home to teach you how to use the Viper effectively and efficiently to unlock common tight tissue that leads to chronic pain. This is Dr. Mike with AMP Sportsman Recovery. Be on the lookout for our specific foam rolling series that will be coming at you, that will be getting filmed today.